Well, Rwanda is set to host the Kigali Summit on malaria and neglected tropical diseases on Thursday. Both diseases affect billions of people worldwide. According to data from the World Health Organization, 23 countries have reached 3 consecutive years of zero malaria cases since 2000. 45 countries have eliminated at least one NTD, including Rwanda. For more insights, I spoke with Thoko Elphick-Pooley, director of Uniting to Combat NTDs, a collective of partners working together to defeat 10 neglected tropical diseases. Take a look.
So although the diseases themselves are called neglected tropical diseases, it's actually the people that they affect that are neglected because they affect the poorest amongst society. They affect 1.7 billion people on the planet and over 600 million on the African continent. So it's a huge burden on the African continent, really impacting our human capital. I call them the diseases of the unseen. People in some of the hardest to reach corners of the earth, people that live in very low resource settings. When you consider just how much can be done for these individuals, the simplicity of some of the interventions and the fact that some of these diseases themselves are preventable, there is actually no excuse that we're not doing anything.
What do you see as some of the major challenges now to combating NTDs?
I think one of the biggest challenges, obviously, is the impact of COVID-19 pandemic. The crisis and the emergency and the nature of the response actually cost us more money than was necessary had we been prepared. And so that money has been diverted from elsewhere. So programs such as those for fighting neglected tropical diseases have suffered. Individuals that are affected by NTDs, in many cases, did not receive the treatment. Funding in some places was cancelled. The progress that was being made prior to COVID-19 is at huge risk if funding isn't quickly restored.
Rwanda is hosting the Global Summit on Malaria and Neglected Tropical Diseases. What is the significance of the summit toward the elimination of NTDs?
It's about putting efforts to fight neglected tropical diseases fairly and squarely in the countries that are affected by these diseases. And Rwanda is an excellent choice because it has actually demonstrated leadership in fighting neglected tropical diseases, having recently been validated by the World Health Organization for eliminating sleeping sickness, and has shown what can be achieved when countries take a leadership role. We are calling on countries that are affected by these neglected tropical diseases to neglect no more the individuals that are affected.
What can endemic countries do to push forward with or without the help of the international community? If one country can do it, perhaps others can do it as well.
It can be done because to date, 45 countries have eliminated at least one neglected tropical disease. And in addition to Rwanda, Togo recently eliminating blinding trachoma. Countries really need to make the fighting of neglected tropical diseases a matter of national priority.
So what should be expected from the Kigali Summit?
So countries really need to be looking at this and thinking, how do we use the fighting of neglected tropical diseases as an exemplar for not leaving anyone behind for the Sustainable Development Goals? It's about recognizing that there are already some bold commitments that countries have made for these diseases, for both malaria and neglected tropical diseases. Identifying the practical steps that are needed to drive progress forward. Where do we need innovations? How do we need to integrate? How do we need to finance these interventions? We're very excited in the neglected tropical diseases community about the launch of the Kigali Declaration on Neglected Tropical Diseases, because it's about everybody coming together and saying, this is what I am going to do for the 1.7 billion people affected by NTDs.
While others are doing their part, meaning countries, donors, community, NGOs, what can citizens do?
We need citizens to say, enough is enough. We cannot, in the 21st century, have individuals with worms coming out of their legs due to guinea worm disease. 1.7 billion people is too big a number for people to be affected by diseases we know how to prevent.